Hi there, I'm just here to talk about breastfeeding because at the beginning it can actually be really hard work, so I just wanted to show you a couple of massage techniques that can actually make it a lot easier. The other reasons it's good to do the massage is that it can actually help with any breast engorgement, help with the milk flow, stop any milk ducts getting blocked. If they get blocked, they can actually lead to mastitis, which is not nice at all because you can have a fever, be in a lot of pain, and end up on antibiotics. So just some simple massages can actually stop any of this happening. So when you actually get the swollen boob and it feels like it's just full of milk, it's actually also an excess of fluid as well. So you want him to do some lymphatic massage, which will help drain that fluid away back into the lymphatic system. A lot of the lymph nodes are actually in your armpit and around here as well. So we're going to do some techniques to try and get that fluid back into the lymphatic system, and then some other ones which are actually directly to the boob itself. So I'm going to just start with just some very gentle strokes along the lymphatic system, which is underneath your collarbone. So going from above your sternum, underneath the collarbone, and just gentle little brush strokes, okay, all the way to the edge of your collarbone. Okay, now you're going to do this about 10 times, starting from the middle and then going out to the edges. Okay, so when you've done that 10 times, you can do some small circles, just little gentle circles. It should be very light pressure, okay, underneath the collarbone. That's it. All the way to the edge. And again, so again about 10 times. That's it. Okay, once you've done that, you're going to get into the sideways position and lean on the top. Okay, now remember, you want to make sure you protect your back. So bend your knees, so you have like an arch in your lower back, okay? And you're not going to obviously end up in this bad posture. So once you're in that posture, what we're wanting to do is, as the gravity is working here, you're going to start by going underneath the boob. So you're going underneath, round the edge of the boob, up into the armpit, okay? So round the boob, up into the armpit. Okay, so we're doing this about 10 times. Once you've done that, you're then going to do a technique underneath the boob where you start from about the middle and you do small circular motions going underneath the boob, all the way round, again up the side, and then back up to the armpit. Okay. Alright, so circles going around the bottom of the boob, all the way around to the armpit. Okay. Now, you're going to actually take your hands and do an almost torsion effect on the boob, where you take one on the top and one on the bottom, and just actually doing them against each other. Okay, remember to keep these knees bent and your back in neutral. Okay, so you're just doing that, and do that for probably about a couple of minutes. You can move them slightly around, so you're just trying to cause that reaction against hand against hand. Okay. After you've done that for about a couple of minutes, then just do some lifting of the boob off the chest wall, and then just moving it up and across. Okay, do that a few times. And then you want to do some really specific massage. So if you have any sore points or lumps, I'm doing some actual specific massage technique into the lump towards the nipple to try and ease that out. It's probably likely to be a blocked milk duct, okay? All right, so just doing that specific massage, doing that for a couple of minutes as well, okay? Now the simple techniques, just doing them probably a couple of times a day for about 10 minutes is about how much longer it'll take, and just keep going with that. If you do have issues, then it's either the things to do are see a lactation consultant. It might be that you need to have help with the latch from your baby, and then also physio can help with doing some massage, and then ultrasound. You can use an ultrasound machine, which can actually help to unblock if you have a blocked milk duct. Okay, well, thanks for watching, and have a go.